Vikas.com.
This is the morning brief from the Economic Times, produced in collaboration with Awaaz.com.
People are falling sick, very sick, and the numbers are rising at an alarming pace as a second wave of COVID-19 cases grip India. As on Thursday, we have crossed 2 lakh cases a day. Yes, you heard it right, 2 lakh cases a day, making us the second worst hit country in the world. Just 5 states, Maharashtra, Chhattisgarh, Uttar Pradesh, Karnataka and Kerala, cumulatively account for around 69% of the total number of active cases in the country as you listen to this. It's no better in Gujarat or in New Delhi. This is a national crisis. Antiviral drugs like Remdesivir are in short supply. So are oxygen cylinders and even hospital beds, leading to long queues outside hospitals, desperate appeals by family members on WhatsApp, Facebook and other social media platforms seeking medicines and other assistance. Even RT-PCR tests are failing to catch the new strains of the virus. There have been reports of crematoriums malfunctioning or cemeteries being full up across the country. Within days, it's gone from bad to worse. It's Friday, 16th of April. From the Economic Times, I'm Arijit Barman, and you're listening to the Morning Brief. But why is there a sudden surge in cases and drop in the availability of medicines and beds? Most importantly, are these antiviral drugs the magic bullet that we have been looking for? Is this a pan-India emergency or pockets that are worse off compared to others? We have our colleagues from across the country to help us with the ground reports. But before we dive into that, I've invited my colleague from ET Prime, Vikas Dandekar, our in-house expert on all things pharma and healthcare, to explain the science behind the wonder drugs like Remdesivir.
There's an extreme shortage of drugs which are used to treat COVID symptoms. Now, Remdesivir is one of those drugs.
Remdesivir is being sold in black in a market in Mandsaur. Dealers are asking for thousands.
Doctors in Kolkata have complained that the antiviral drug is in short supply. Pharma companies say that it would take them at least 2 weeks to match the demand.
Vikas, thank you for joining. And I want to start by asking you, what is Remdesivir and how does it work?
Right. Thanks so much, Arijit. So basically, Remdesivir is an old drug which was actually tested first time for indications in Ebola.
Okay.
That outbreak happened in 2015, and since there was nothing really available, Gilead tested that drug to see if there is some activity that the drug can actually have on Ebola patients. Now, at that point, it didn't really work, but it had significant indications to suggest that it might work for this viral outbreak. So on a fast track emergency basis, the US FDA studied the clinical trials and gave its first approval in May on an emergency use basis. That approval also was actually controversial in a way that, it didn't really do much in terms of clearing the virus as such. It could reduce the extensive damage that probably was created on the lungs, but it only suggested that from 14 days in ICU, the stay can be reduced to 11 days. So there was no mortality benefit. That means the death cannot be prevented. But, in a crisis, everything looks great if there is a ray of hope. So this drug got the approval.
So Remdesivir was first tried and tested on Ebola patients. It had mixed results. Then cut to 2020 or end 2019, early 2020. Corona hits the world. No drug was available. Doctors relied on Remdesivir because some kind of relief was seen. Am I correct?
Absolutely spot on. Exactly.
Okay. And since then, more and more reliance on this, because still now there is no foolproof medicine to handle COVID-19.
Yes. So apart from Remdesivir, all that we could actually get in terms of a foolproof evidence is dexamethasone, which is a steroid, but that actually comes only when the patient has advanced to severe illness. And yeah, so because there is a problem that if you actually give a steroid early on, steroid, by the way it works, it actually suppresses our immune function. So if you give it early on, then while it might have some effect on the virus, but it actually has a huge risk because it suppresses the immunity, and then the secondary infections can come in. So the use of dexamethasone has to be done very judiciously. And so, that just happens because it can work only in severe patients.
No, but you're saying even Remdesivir should only be given ideally to patients who are critical or in ICU. It's not like, you're feeling a little feverish, you go to the store and say, give me this, and you pop 2 pills or you take that injection. It's an injection, right? It's not it's not really a medicine.
Absolutely. So that's a great question. It's an infusion injection, and it has to be given only in hospital settings. Now, the question that you mentioned is very, very important here. Earlier, we used to have severity develop only after 6, 7, 8 days.
Right.
So what has happened now is the severity in terms of the lung involvement actually is being seen firstly in younger patients, and the ferocity, the speed at which the lungs are getting infected is just about 3 or 4 days. I have seen CT scans of patients who are like 25, 28, where the lung involvement is about 40%. Now, according to the task force, we are seeing that, it can be given between 2 and 9 days. The Maharashtra task force also says that very clearly, that it can be given in moderate patients. But it also mentions that please do not treat it as a lifesaver. So when you actually counter the doctors, I spoke to Dr. Rahul Pandit from Fortis Mulund. He says today there is a desperation. I am seeing patients going on ventilators at 20 years age. Do you think I should wait till that time, or should I actually start giving whatever I have at my disposal? And so you are actually seeing that bounce. So one is the bounce is happening because of the severity. Onset of the severity is faster. Secondly, the surge itself is so high. Earlier, we saw a peak of 2,500 probably in Mumbai. Now it is going to some 10,000, 9,500. So even if you take moderate patients at 10%, we need 1,000 injections per day. And just last communication that Uddhav Thackeray mentioned was about 50,000 injections a day for the entire state. So that actually has created a massive demand problem, because most of the manufacturers had actually gone very low in terms of producing the injection, and now you actually have to go through the 2 or 3 week of production cycle to bring it back to normal.
I was made to believe that in many cases doctors are relying more and more on drugs like Remdesivir because they want quicker turnaround in ICU so that more and more patients can be treated. Is that so?
That's absolutely right. Because today we are seeing that saturation coming behind every bed. There is a wait of about 4 or 5 patients. So if you can actually feel that, the reduction in the lung injury can be quickly handled, then you can actually release the patient, give him the discharge, and the next patient can come in, because this peak is not going to end very soon.
There is a tsunami of cases which has battered India with this fresh wave, which is said to be the worst ever, the most infectious and the most fatal one.
Yesterday, as I said, the state of Uttar Pradesh reported over 18,000 cases, and that's a staggering figure, because even in the first and second phase, we had not really seen the rise in number of cases in the state of Uttar Pradesh to this effect.
और आपको एक बार फिर से बता देते कि महाराष्ट्र की हालत देश में सबसे ज्यादा चिंता का विषय बना हुआ है सबके लिए, केंद्र सरकार हो, राज्य सरकार हो। आपको बता दें 50,000 से ज्यादा कोविड के नए मामले सामने आए हैं। कोरोना की शुरुआत के बाद से ये महाराष्ट्र में दूसरा सबसे बड़ा आंकड़ा है, जिसकी वजह से महाराष्ट्र चिंता का विषय बना हुआ है।
There are no beds for patients, and hence a woman was hooked onto oxygen in a rickshaw which was parked outside.
To give us the real picture from the front line, we have three of my colleagues from our various bureaus. From Lucknow, Uttar Pradesh, I'm joined by Vatsala Gaur. Akshatha Rao is also joining us from Bangalore to give an overview of Karnataka, Tamil Nadu and Kerala. And from ET Mumbai, Krishna Kumar, my colleague, who has been warning us for days about this looming crisis, much before it became a national headline once again. Thank you everyone for taking time out and doing this. Krishna, Maharashtra is arguably the most affected state as we speak. What went wrong? Did we just become complacent? Why suddenly this surge? If you could explain to our listeners.
Arijit, the fear of COVID is not that much as it was last year. That is one of the reasons why people did not wear masks. They went about their business. The people were forced to go to their work and all that. They lost their livelihood and all. So they had to go out. That also led to the spread. And I believe that, with the vaccines coming and all that, by and large, the understanding was that the things are under control. That 2020 was an aberration and things will not happen like that again.
So, Krishna, cut to 2021. We are now in panic situation and we are seeing videos and WhatsApp messages and Twitter feeds. What's the situation now? How bad is Maharashtra? Is Bombay the nerve center or the epicenter of the crisis?
See, Pune is getting more cases. However, Pune is still managing it well. One of the reasons why Pune is getting more cases is because, Pune is getting cases from Nagpur. So, Nagpur, all the remote parts, I have spoken to IS officials in Pune. They are saying we are getting cases from Nandurbar. Nandurbar is actually closer to Gujarat. People are coming from Nandurbar and all these places, Latur, Dhule, and all coming to Pune. So, Pune is actually managing the situation well. Mumbai, if you remove the part about, that these cases are coming from outside the districts in Pune, we would see that actually Mumbai is actually one of the most worrying part, because right now every day we are I'm engaged with certain groups that try to help out people with beds, drugs and all that, and we are finding it extremely difficult to arrange beds for people. Every day, we have 10 to 15 people who are just simply not getting beds at all. They are turned away from hospitals. Things are quite bad in Mumbai.
So Mumbai is where you're saying it's the worst off amongst all the other districts or other centers?
No, even Nagpur. See, smaller centers, what happens is Mumbai is has that much health infra that at least you can... Yeah. But in places like Nagpur and all that, you have visuals which show that, patients are being put on the floor, on the chair. In Nashik, there was a woman who did not have any space to come inside the hospital. So she was in the rickshaw that she came. The hospital guys brought huge oxygen cylinder and gave her oxygen right in the rickshaw. That's in Nashik. So in smaller centers, it's quite horrible.
Okay.
But Bombay, in terms of the number of cases, it's too much. So it's around 7,000. I think it was around 7,000 yesterday. But on average, if we allow proper testing and all, as we had done around a week back, then we will see that around Mumbai is getting around 10,000 cases per day.
I guess Mumbai is also the most densely populated. So that's another additional worry.
उत्तर प्रदेश सरकार के मुख्यमंत्री योगी आदित्यनाथ की कोरोना रिपोर्ट पॉजिटिव आई है। सीएम योगी ने ट्वीट के जरिए जानकारी देते हुए कहा है कि शुरुआती लक्षण दिखने पर उन्होंने कोविड की जांच कराई थी, जिसकी रिपोर्ट पॉजिटिव आई है।
उत्तर प्रदेश में कोरोना वायरस संक्रमण के मामले तेजी से बढ़ने लगे हैं। राजधानी लखनऊ में बुरा हाल है। यहाँ शनिवार को एक दिन में रिकॉर्ड 4,059 नए केस सामने आए।
Vatsala, Akshata, both of you, the worry for me personally is the fact that unlike 2020, or we call it the first phase, this time around it seems that the virus has spread to the hinterland. So, Vatsala, Uttar Pradesh is a massive state. It's almost bigger than many countries of Europe. One is Lucknow. I mean, I would like to know how is the situation in Lucknow, but more importantly, how is it in smaller centers, in eastern UP or in central UP, which are not necessarily, as developed as, other parts of the country?
Okay, so the situation in Uttar Pradesh right now, if we're talking about, so it's very grim, but only the urban centers seem to be vastly affected as of now. So you say Lucknow, Prayagraj, Kanpur, Varanasi. These are the urban centers. When you talk about the smaller towns, the thing is that people from the smaller towns are rushing to the bigger centers. So that is how the pressure has been created in these bigger centers. Now, what has happened is that now the state had created almost 1.5 lakh beds across the state. Now there are 75 districts across Uttar Pradesh. And what happened in February beginning, like around 2nd, 3rd February, it denotified more than 80% of the COVID hospitals because daily cases had gone down below 100. You were reporting daily cases in double digits. So that's when the government thought that it was okay to resume normal medical treatment in hospitals. So it denotified more than 80% hospitals across the state. Now, from more than 300 hospitals, the number of hospitals came down to 82, 83. So that's like in most of the districts, there was just one COVID hospital. So now suddenly the nature of this new surge is that the rate of growth is far higher than the rate at which the state is able to add new infrastructure. So now if you talk about Lucknow per se, which has become the epicenter in UP, it had been reporting less than 1,000 cases in early April, which is right after Holi. And now it is reporting more than 5,000 daily cases. So that's the rate of growth, if you look at it, which is even more menacing. Testing has become a huge nightmare because a lot of the private labs in Lucknow are not able to test because they have their laboratories in places like Gurgaon. So the state has asked them to either create their laboratories locally because otherwise the turnaround time, by the time you give a sample, the report comes, it's taking, 3-4 days, more than that. So they have been asked to stop testing. Now that has put more pressure on the government facilities. So testing has become a nightmare. There's a shortage of beds. There's an issue that is unique to Lucknow, I'd say, that even if you have a positive test report, and you have to get a bed, you have to route it through the CMO office. Like you can't just walk into a private hospital and, show them your positive test report and ask them to admit you.
These are unnecessary bottlenecks, I believe. I can understand that the state machinery has to stay vigilant. But if you're tested positive, let the doctors take a call rather than a babu sitting somewhere, taking a call on your behalf. I mean, this is what I don't get. And for our listeners, Vatsala, when you say CMO, it's not the chief minister's office.
No,
it's the chief medical officer, which associated with each district.
Yeah.
So it comes under the district magistrate, correct?
Yes. Yeah.
Akshata, sitting in Bangalore, suddenly you see cases really going through the roof. Bangalore, if I'm not mistaken, was one of the first or the earliest to come back to, shall we call it, normalcy within course. Many more people were venturing out much before maybe even New Delhi, Bombay did. So right now, is the crisis largely because, just like Uttar Pradesh, hospitals have denotified these dedicated COVID wards, or is it just because, there's just chaos on the streets?
So, Arijit, in Bangalore, obviously the cases are rising. We had some 11,500 cases yesterday, which is all-time high. I mean, we didn't have so many cases even during the first wave. So the situation is bad, but then it's not even as bad as Maharashtra or UP in the sense that there's no issue still. Largely there's no issue in getting beds. That's because 95% of the patients are asymptomatic and they don't need beds. And also most hospitals have upgraded themselves to have oxygenated beds. Like most of the government hospitals have oxygen supply to their beds these days. So that's not an issue. But from what I hear is that if this trend, if this surge continues for another 2 weeks, then it's going to be a problem. We started seeing a surge in the first week of March, and it's been 6 weeks now. It's slowly going up, but then we can manage. I mean, the city administration says they can manage with the availability of beds. It's not that bad, but yeah, exactly. Like in other states, if the cases surge in another 2 weeks, then we'll also have shortage of beds.
But Bangalore is just one center. Karnataka, much like Uttar Pradesh or Maharashtra, is a big state in itself. What about other urban centers or rural Karnataka?
So interestingly, 70% of the cases in Karnataka are from Bangalore. So out of 11,000 cases yesterday, almost 8,000 are from Bangalore, which means the infection hasn't spread across the state. I mean, there are cases from other urban centers like Mysore, Mangalore and all, but it's still not that bad, and it has not yet reached hinterland, it seems, at least as of now.
Oh, that's really, that's really good news, because that's my worry, is that, this time around, chances of it moving to much beyond the urban centers. And are we really in a situation to handle that surge, that kind of surge in traffic?
Yeah, maybe it's too early to say. We never know. Like now there are restrictions. Karnataka government has imposed restrictions only in 8 cities, whereas most of the other districts don't have such strong restrictions like night curfew and all. So in that case, there are possibilities that they would also see a surge in near future.
And what about neighboring Tamil Nadu and Kerala?
So the pattern is quite different in Tamil Nadu. They also reported some 7,000 cases yesterday, which is also its all-time high. They did not report so many cases even during the first wave. But then in Tamil Nadu, only 30% of cases are in Chennai, whereas the rest of the cases are all spread across districts. So it's a very different trend when you compare it to Karnataka, right?
Just the opposite.
Yeah, exactly. And that's the reason why Chennai is still not overburdened. I mean, the number of patients there are less, so there is not so much demand for hospital beds, unlike Bangalore. And in Kerala, Kerala started seeing a downward trend in cases from mid-February, and then there was no restrictions at all for 1.5-2 months because of elections. And then they started seeing an upward trend from the first week of April. And all of a sudden, in 10 days, they have seen an increase in case by 7-fold. Like yesterday, I think it reported some 6,000 to 7,000 cases. But then
7-fold increase.
Yeah, in 10 days. That is from April 2nd, April 3rd to April 14th.
What does that translate to in just an approximate number?
They were reporting 1,000 cases on April 3rd or 4th. And the day before yesterday, I think they had 6,500 or 7,000 cases. But what's interesting is that Kerala has been able to contain the number of deaths. So although cases have been more, overall death rate has been quite less compared to all other states in Kerala right from the beginning. So that way, they have been able to manage the situation pretty well.
Mm-hmm.
And the number of deaths is less even in Karnataka as well as Tamil Nadu. So during the first wave, Karnataka was reporting almost 100 deaths a day when the daily cases were about 8,000 to 9,000. Whereas now we are reporting 10,000 cases a day, whereas death rate is anywhere between 40 to 60.
I see.
So the situation, they say, is not that grave compared to the first wave yet.
So if I understand this correctly, across the 3 states, yes, it is serious, but it is not yet panic.
Right.
Krishna, a quick word on the death rate in Maharashtra, and also Vatsala, after Krishna, if you can just chip in as well. Is Maharashtra seeing a spike also in the mortality rates?
Mortality rates in Maharashtra are not rising, as Akshata said. It's not rising as much as it was in the first wave. So that is the thing about the second wave, that it's spreading fast, it's spreading exponentially, but the death rate is not as much as it was earlier. But however, the thing is, if cases go up, as Akshata said, that once these cases go up, the death rate will eventually also go up.
Of course. And Vatsala, similar?
I would agree. Yeah. yeah, like even though the rate of growth is really high, thankfully the death rate, the growth in deaths is not as menacing. Like yesterday, there were more than 20,000 fresh cases that were reported in UP, but only 68 deaths. And this has been the pattern, throughout since this new surge, second wave was seen, emerging. So that is a consolation.
Right. Akshata, just a quick word, very briefly. If you have to pick, where is the pressure point? Lack of beds, or is it lack of antiviral medicine or oxygen? Where are you seeing maximum stress in the system?
I think availability of beds and oxygen, because that's going to be hard to find in another 2 weeks. And I don't think we are prepared. We haven't geared up our infrastructure and the system to deal with this situation. Nobody expected that the cases would reach this level, right? So that's going to be a huge problem.
Vikas, you've heard the situation from the length and breadth of the country. Very grim indeed. But coming back to Remdesivir, because most people, it seems to be the magic bullet, although you clarified early on in the show. But there remains question marks over the efficacy of Remdesivir, right? I mean, US FDA said it's fine. Other tests are certainly are more circumspect. So if you could help us understand.
As we speak to the doctors, most of them are actually feeling very agitated that, why are we talking about use of Remdesivir? We don't have a luxury of choice. If there is one antiviral drug which actually shows some benefit, why don't we use that as part of our arsenal? We don't have the luxury to do sequential use. The point that doctors are saying that, if any of these things work in terms of saving my patient, I'll not hesitate in using it. Now, there is a element of side effect also. Most of these drugs may have hepatotoxic effect. I mean, it might injure liver. But I think that is something that they are actually putting it at the back burner for now. For the benefit of saving the patients.
And you also have medicines like, tocilizumab, which is also something that A, is in short supply, and B, doctors are using. Is that separate and different from Remdesivir or from the same family?
No, so this is again a repurposed medicine from Roche, which has been in use for rheumatoid arthritis, which is generally an autoimmune disease. The problem here is, Arijit, the price of tocilizumab per injection of 400 mg is, I think, 40 to 45,000 rupees, and that probably is being heavily in the black market because so unlike Remdesivir, which has got like 6-7 producers in India, tocilizumab it's a mAb, it's a monoclonal antibody, it's a much more complicated drug. It is sold by Roche through Cipla, and it's a single manufacturer. Now, though the use is only very less
cases.
Very less. It's at the extreme severe cases, but the price and the availability both are very, very difficult because it's a single manufacturer first, and secondly, it's very, very expensive.
Correct.
Jai Hind, Barun Jai Hind, Bande Mataram, Jai Bangla, Jai Tinamul, Jai Bangla, Jai Bangla, Jai Nandigram, Jai Nandigram.
The NDA family seeks your blessing to serve the people of this state. We seek your vote based on a solid agenda of all-round development, inspired by the ideals of MGR and Amma Jayalalitha ji.
കാരണം LDF ജനങ്ങൾക്കൊപ്പമാണ്, ജനങ്ങൾ LDFിനൊപ്പമാണ്. ഇത് നല്ലതുപോലെ ഇനിയും നമ്മുടെ നാടിന്റെ പ്രതിപക്ഷം മനസ്സിലാക്കേണ്ടതുണ്ട്. നിങ്ങൾ നാടിനു വേണ്ടി ചിന്തിക്കാൻ സന്നദ്ധമാവുക.
But Vikas, what is amazing is amidst all of this, and Vatsala can tell us a little bit about it, the panchayat elections in UP starts from today. It's unbelievable, but that's India for you. Vatsala, no plans of a review or a postponement?
No, because they've already begun. Today, the first phase begins, and people, we could already see visuals of people lining outside polling centers to cast their votes. A lot of the pressure that has been put on the urban centers was because of people coming back for the panchayat elections and Holi. Also, the wheat harvesting time. This is the wheat harvesting time. So people traveling from states like Maharashtra and Delhi and coming to UP, that really triggered the spike here.
And this is really where I have a huge problem. I mean, I am in West Bengal for the last almost 2.5 weeks, where we are having an 8-phase election. 8 phases, longer than probably a World Cup. And nobody is following any protocols. Politicians, civil servants, police, there are people from the outside of the state, CRPFs, paramilitary forces. Nobody is wearing masks. Nobody is following any protocol whatsoever. This just defies any logic. Akshata, final questions to you. Tamil Nadu, Kerala, we've seen elections in those states as well. And what you just said, that right after that, there's been, a spurt. So there is a direct correlation that if you have a Kumbh, or if you have something like a Holi or election or large congregation of people, chances are it will spread and the virus will become more and more fatal.
Absolutely, Arijit, because there was massive crowd in Tamil Nadu and Kerala during elections from the first week of March till April 6th. And although COVID cases were on the decline till then, till the first week of March, there was a sudden surge. And especially in Kerala, there was sudden surge in the first week of April, soon after the election. So there was absolutely no restrictions. People were COVID protocols went for it all. People were all over the place. And then there was a surge, and it's soon after the election, both the states announced numerous restrictions like night curfew and asking pubs and restaurants to have just 50% of capacity. So I think there is a direct link between election and increasing COVID cases.
But we can only pray that some sense prevails, and it's bizarre to have events like the Kumbh at a time like this.
And amid the ongoing Kumbh Mela in Uttarakhand, senior police officials have raised concerns about the COVID situation in the state, while thousands of priests and devotees took the holy dip in Ganga for the Shahi Snan.
My take, the worry is, so far the crisis is largely concentrated around bigger cities. But as everyone said, it's spreading far and wide to the hinterlands and rural centers. And our healthcare infrastructure is just not equipped to deal with it. In the middle of this pandemic, events like the Kumbh Mela or Holi have been suicidal, to say the least. Hoping the Election Commission will at least compress the remaining 4 phases of elections into a single phase voting in West Bengal. Same for the Uttar Pradesh Panchayat polls. Unmasked mass gatherings must be banned, else the smart decision to expand our vaccine basket will have very little impact. But honestly, the onus lies with each one of us to be responsible citizens and follow the protocols. I'm Arijit Barman, and you've been listening to The Morning Brief. This episode was edited and coordinated by Nehal Chaliawala, John Chacko, and Anjali Venugopalan. I hope you enjoyed listening to this episode. We look forward to your feedback. Write to us at themorningbrief@timesgroup.com. And if you like this episode, please share on your social media handle. We'll really appreciate it. The Morning Brief drops every Tuesday, Thursdays, and Friday. Thank you for listening in and have a nice weekend. Goodbye and good luck, and stay safe.
Awaaz.com